Shayla, my name is Sarah. I'm a nurse practitioner student with Nebraska Methodist College, and I'm here to do the examination on your lower extremities today. Is that okay?
Yes.
Wonderful. Okay, Shayla is a well-developed, well-nourished 45-year-old female and does not appear in distress today, is a good historian, and her vital signs were normal, so we're going to go ahead and get started. Is that okay?
Yes.
Wonderful. Shayla, I'm going to have you stand up and step off of the, yep, perfect. Now what I'd like for you to do is walk across the room, and I'm just going to watch your gait as you do that. Go ahead. Okay, wonderful. Come and walk towards me. And you can go ahead and sit down on the bed. Gait has a smooth flow to it. She is normal weight bearing. There were no missteps. Appears appropriate. Okay, so first I'm going to start with inspection of the hips, the knees, the feet, and the ankle. I am going to slip off your socks.
Okay.
If that's okay. And I'll just set these right here. Okay, so let's start with the hips. If you would stand up for just a moment. And hips appear to be symmetrical. And I do not note any abnormal bony prominences. I'm going to look at the anterior side of her hips. Again, her hips appear to be normal in position, and there are no abnormal bony prominences. And you can sit down again. I'm going to inspect the knees. The joints do not appear to have any swelling. There are no abnormal bony prominences. And again, in a normal clinic situation, Shayla, of course, would have a gown on so that we could visualize all of this a little more clearly, but she is fully clothed today. I do not note any bogginess, no change in color. Her hips and knees both have, her skin color is appropriate for ethnic origin, and there doesn't appear to be any redness. And I'm going to have you stand up. I'd like to look at the back of her knees as well. So no redness. I don't see any abnormal skin alterations. No nodules. You can go ahead and have a seat here. Now I'm looking at Shayla's ankles and feet. And again, I do not notice any abnormal bony prominences. I do not see any calluses or corns. That's great. There's no swelling noted, no redness, and they appear to be symmetrical. Okay, so now I'm going to start with palpation. And Shayla, if you would stand up again, I'm going to note, palpate your hip bones here. This is the anterior sacroiliac spine. And I'm palpating those on both sides, moving down to the greater trochanter. Okay, now I'm going to have you turn around. Oh, bless your heart, thank you. And I'm going to palpate the posterior sacroiliac spine. And trying to feel for the sacroiliac joints here. But these appear symmetrical. There are no abnormal bony prominences. Okay, that's perfect, Shayla. If you want to, go ahead and have a seat again. Okay, so now I'm going to start with palpation of the knee. I'm going to pull these down a little bit. Okay, so I'm going to start at the patellar tendon, noting where that inserts at the tuberosity here. And I'm feeling around the patellar region. There are no abnormal bony prominences, no nodules. And I am now feeling where the femur and the tibial joint occurs. And any pain there, Shayla?
No.
At all? Wonderful. And again, there's no bogginess, no swelling, no meniscal pain?
No.
I'm feeling for the MCL and LCL as well. No pain?
No.
Okay, wonderful. And I'm going to do the same on the other leg. Feeling for that patellar tendon where it inserts into the tuberosity. And I'm palpating, comparing to the other side, that joint. Any pain?
No.
Feeling for meniscal pain, and also palpating for the MCL and LCL ligaments to see if there's any pain there.
No.
Okay, wonderful. Palpating that patella. I don't note any effusions. And I'm also palpating the pre-patellar region. Can you extend your leg? Wonderful. And down. And the same on this leg. And the pre-patellar region appears to be intact. No swelling, no bogginess, and that appears to be normal. So they are symmetrical. No bruising, no redness, no heat was noted in the joint. So we're going to move to the ankles at this point. So what I'm doing is I'm looking at Shayla's ankles. They are symmetrical. And I'm palpating the Achilles tendon. And looking at that, there are no nodules, no heat, no redness, no swelling. Comparing that to the other side, no nodules noted on either side, no heat, no swelling. I'm feeling the calcaneus on each side, comparing those. Any pain, Shayla?
No.
Okay, wonderful. And I am now feeling the malleolus. Any pain?
No.
Okay, wonderful. No swelling noted. Any pain?
No.
Wonderful. No swelling noted. I am also, any pain, Shayla?
No.
Okay, wonderful. No swelling noted, no redness, no skin alterations. And I am feeling now the metatarsal bones in her feet. Any pain with that,
No.
Shayla? Same on the other side, comparing the two. And I am feeling in between the metatarsal joints as well as the joints on both sides, comparing for symmetry. And I'm squeezing those together. Any pain?
No.
Wonderful. Any pain?
No.
Wonderful. Good. Now, at this point, I am going to palpate the medial and lateral aspects of her toes at the proximal and distal joints. Same on this side. Comparing them for symmetry. I don't note any nodules, any abnormal bony prominences. Okay, that looks good. So now we're going to do some range of motion tests, okay? So what I'm going to have you do, Shayla, for part of the hip test, I'm going to have you stand up and just step on the floor.
Okay.
And I'm going to move this in. Okay. Okay, wonderful. So for flexion, I'm going to have you bring your leg up and down. We're going to do it on both sides, okay? That's perfect. And same on the other leg. Nice smooth movements. Okay, for extension, Move your leg back. Perfect. And same on the other side. Okay, movement is smooth, normal flexion and extension. So for abduction, what I want you to do is move your leg to the side, away from your body for abduction. Perfect. And we're going to do the same on the other side. That is perfect. For adduction, I'm going to have you move it past the midline of your body. Perfect. And go ahead. Perfect. That is wonderful. Extension, flexion, adduction, and abduction movements are normal in the hips. And I'm going to have you go ahead and have a seat. And I will, at this time, have you lay back. Perfect. Oh, got it. And what I want you to do is bring your knee up like that on both sides. Wonderful. And the same on this side. Wonderful. Okay, and let's go ahead and have you sit back up. That was probably a little overkill, but the hips have full range of motion, and the motion is symmetrical on both sides. The movements are smooth and fluid. I didn't note any abnormal articulations or fasciculations. Okay, so for range of movement on the knees, what I want you to do is extend each leg. We're going to do it on this side and back down, on this side and back down. And let's see, for adduction, we're going to move this knee. I'm going to move it to this side. Wonderful. Same with this knee. Adduction movements are normal, and for abduction, we're moving it away from the body. Rotational movements with the knees are normal and symmetrical. Any pain with that, Sheila? No. Excellent. Okay, so we're going to move down to the ankles, and can you flex your feet? Okay, flex them again. Dorsiflexion appears normal, and point them like you're standing on your tippy toes. Perfect. Plantar flexion is normal as well. Okay, so that's good. Now I'm going to move your toes. Can you point them up towards the ceiling and down? Perfect. Okay, so I'm just moving them, noting if there's any difficulty moving the toes. And there's not. Okay. So I think that concludes our lower extremity test today. Do you have any questions?
No.
Okay, wonderful. Thank you so much.
Thank you.
Move a little closer. Okay.
Shayla, I forgot. There are some special maneuvers that if you were having knee pain, anything like that, that I would need to do. And to assess for meniscal injuries, I would do the McMurray's test. To assess for ligament injuries, I would do the valgus and vargus testing on the joints in the knees to assess for ligament injury, as well as Lachman's test to assess for ligament injury. Okay?
Okay.
Thank you. And also to assess for any ankle injury, I would do the anterior box test and posterior box test, and I would also do those for your knees as well.
Okay.
So I think now that concludes our lower extremity test. Thank you.
Thank you.
Okay, 14 minutes, 32 seconds.
Perfect.